Welcome to the Douglas County Chamber's Greystone Power Luncheon. I'm Matt Barrington with Regions Bank and your 2014 Chairman of the Board. Before we give thanks for today's delicious lunch, I would like to offer a special thank you to Chairman's Club member Sam and Roscoe's for the catering. As always, it's outstanding. We appreciate you doing it, Roscoe. And now if I can get Bill Osborne of the City of Douglasville to come forward and lead us in our invocation and pledge.
Let us pray. Father God in heaven, we come to you now in the name of your Son Jesus, just thanking you for another day of liberty, another day of life, another day that we can enjoy fellowship with each other and just enjoy the community in which we live. Lord, we thank you for health. We thank you for being able to enjoy life in many, many ways. Bless this food to the nourishment of our bodies and us to your service, and may we always seek to serve you and do that in part by serving each other. In the precious name of Jesus we pray. Amen. If you'd stand with me, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Bill. At this time, I'd like to invite our luncheon sponsor, Craig Owens, president of Wellstar Douglas Hospital, to come forward and say a few words and give us an update on the expansion happening at the community hospital. Thank you, Craig, and we appreciate you coming up here and talking about it.
Thank you, Matt. I am not Rachel White, but I really appreciate Rachel being here today to talk to us about what we shouldn't have eaten at lunch today, so she'll be up here shortly. There's a lot going on in healthcare these days. I'm sure all of you are aware that there's rapid change in our industry. We've got a number of changes throughout Wellstar. I just want to give you a brief update on what's happening. Those of you that live in Douglas County know that there's been a tower crane over at Douglas Hospital for the last 6 months or so, and we are excited to be on the last lap of our project to build a brand new ICU. We will have that project complete in the month of April, and in May we'll be doing fit and finish, and we'll have an open house at that time. We'll invite everybody out to come out and see our new facility. I have to give a plug though for our Paulding Hospital. They are finished with their construction, and they have open house opportunities. I encourage you to go to wellstar.org and find out when you can go and tour that new hospital. It really is spectacular. But Douglas Hospital, once we finish our ICU, we are going to move out of the current location, and that space will be part of our emergency department, so we'll be adding some capacity to our emergency department as well. So it's an exciting time for us, and we'll get an announcement out when you can come and see our new facility. Around the health system, the other big project we have going on right now is we're launching a new electronic medical record system. So you'll hear the terms Epic, you'll hear the terms Wellstar Connect, and what that means is that we are developing and will launch the final phase of implementation of that project in April. It'll mean that if you come to the hospital, all of your records from across the health system will be available electronically to the practitioners there. So if you're seen in the doctor's office one day and you need to be admitted to the hospital 2 days later, that's the same record that they'll be looking at. So as you know right now, all those records across the continuum are separate, but we'll have a continuity of care that'll be delivered by having one record across the health system. So it's an exciting change for us. We will go live with that system on April 6th at Wellstar Douglas Hospital. A couple other announcements very quickly. I'm honored to announce, and you may have seen the press release, that Candace Saunders, who is the System Chief Operating Officer right now, has been promoted to the President of Wellstar, and she is co-leading the system with Reynolds Jennings. Reynolds is our Chief Executive Officer. But Reynolds' engagement with us, we brought him out of retirement to lead the health system to the next step, and he will be retiring at the end of next year. So Candace has been named as Reynolds' successor and will take the helm for Wellstar at the end of next year. The other announcement that received some attention, I just want to provide a little more explanation, is that Wellstar has partnered with the Mayo Clinic. We are now a member of the Mayo Clinic Care Network, and there's some very exciting partnerships that are going to go on between Wellstar and Mayo. Obviously, they're known worldwide as the leader in research and excellence in care. We believe it brings another dimension to Wellstar services. And one of the opportunities we will have now is when our physicians see a patient and they have questions or they want a second opinion from a physician, that clinic partnership will allow them to pick up the phone and to speak with a partner at Mayo Clinic and talk about that patient's care and what are the best steps, what are the next steps for that patient. How can we bring that intellectual capital together to improve the care for our patients? So it's an exciting time to have a partnership between Wellstar Health System and the Mayo Clinic. So as we move forward, our commitment is to provide the highest quality of care that we can to our community through improving our facilities, improving our clinical care, and delivering the kind of care that you expect for yourselves and your families. So thank you very much. We appreciate the opportunity to sponsor today's luncheon, and thank you for your time.
Thank you, Craig, as always, and for your support of the Chamber and support of the community. Did y'all know that March is National Nutrition Month? I didn't know until I read this right here. It is, and I would like to introduce today's guest speaker, Rachel White with Wellstar. Rachel earned her bachelor's degree in dietetics from the University of Georgia. She then went on to the Mayo Clinic in Jacksonville, where she completed her dietetic internship. She is a registered dietitian, certified specialist in oncology, and certified nutrition support clinician. Easy for me to say. I can't say it. Although she spends the majority of her time working with cancer patients, she also enjoys speaking throughout the community on healthy eating and disease preventions. Ladies and gentlemen, Ms. Rachel White.
Thank you, Matt. Sorry about the clinician there. I knew when I put that in there, I'm like, this is going to be a tongue twister for somebody. Let's see how many certifications I can throw in there and mess you up. But just everybody can take a deep breath and, don't worry about your lunch you just ate. It didn't have a label on it. So that pasta, I'm not going to judge you on the fat content of anything or calories of anything. But we are going to talk about the nutrition facts label. As a dietitian, it's probably one of the most common areas of confusion, probably one of the biggest areas of concern. I have patients frequently ask me about the label, just how to interpret it. So we're going to go through that today, kind of break it down, just so hopefully next time you are looking at a nutrition facts panel or looking at a label, you do understand a little bit better about what those numbers mean and exactly what you do need to focus on. So today we're going to discuss the nutrition label itself, the ingredient list, the packaging claims, and then last we're going to go through the portion sizes because that's probably one of the biggest areas of concern. Over the last few weeks you've probably heard a lot about the label in the news. It's kind of a hot topic. The FDA is proposing a lot of changes to the label over the next couple of years. Partially because it is so confusing and it is so misleading. The general public has a really hard time knowing exactly what you're looking at and what you need to focus on. So first off, where do we start? Really the most important part of the whole label, the whole ingredients panel, everything, is the serving size. That's probably one of the biggest changes we'll see over the next couple of years. The serving size on so many of our products is not correct. I mean, our portion sizes have really changed a lot over the last 30 years when the label first came into making. So the most really important thing that you really do want to look at, though, is that portion size. Just kind of a general rule of thumb, the serving size is always the top on the nutrition facts panel. You want to make sure that you are eating that serving size, and if you're eating more than that, all of this information on this label is going to change. So just an example, a serving size, a general serving size, say on a carton of ice cream, is a half of a cup. How many of you, see, you're already laughing, so you know, who eats a half a cup of ice cream? So if you are, yeah, it is pretty comical. I know that they say the general serving size of ice cream, general population is a cup to a cup and a half. My husband probably eats 2 to 3 cups of ice cream sometimes. So, if you're sitting down to dinner at night and you think, say your ice cream says you're eating 100 calories, that's 100 calories for a half of a cup. If you're eating, 2 cups, you really need to rethink this whole panel. You're getting a lot more calories, getting a lot more fat than you think you are. So these changes hopefully will be really be a good thing. It won't be so misleading. The next step of focusing on the total calories and the total fat. These are just some kind of general guidelines. If it's as far as calories go, a product is 40 calories or less, that's low. 100 calories is moderate. And if you're taking in 400 calories for one item, that would be considered high. And these daily values, this is something else that is very confusing to people. You'll see the daily value is along the right-hand side of any label. And basically what these values are, it's based on a 2,000 calorie diet. So again, kind of like the ice cream, can be kind of comical because a lot of people eat a lot more than 2,000 calories. A lot of us in this room, as far as, women, we may need 1,500 calories, we may need 1,800 calories. And then there's some men in here, if you're an athlete, if you exercise, if you are a larger man, you may need, 2,500 calories, 3,000 calories. So this daily values is something that I do hope that we see changed as well, just because it's kind of a one-size-fits-all method, and it's not really a good indicator. It's really supposed to be a daily value, a percentage of what your entire day. So say if, on this label you have the total fat, this item is 12 grams of fat. So that's 18% of the fat that you need for the day. But you have to adjust this. Say if you're somebody that needs 1,400, 1,500 calories, that value is going to be completely different. So take that into consideration. And again, I hope we see some changes as far as the daily values go. Maybe having multiple values, based on a 1,500 calorie diet, a 2,000 calorie diet, 2,400 calorie diet, some things that are a little more realistic. Again, as far as the daily values go, there are some things, some ways that the values can be helpful. If it's 5% or less, that would be good when you're looking at fat or cholesterol or sodium, some of the things that we really do get too much of in our diet and we need to decrease. And if it's 20% or more, that would be considered high. So those are things like fiber or things like vitamin D or calcium, vitamin C that we may need more of in our diet. So the values are just a good way for you to judge. So first we're going to talk about the good. These are the things that we don't really get enough of as a whole in this country. Things like fiber, vitamins A and C, calcium and iron. These are all really helpful for decreasing your risk of osteoporosis, those people that may be anemic. So choosing more fruits and vegetables, more whole grains, more whole foods in general. We'll talk about that a little bit when we get to the ingredient list. But really doing more of these foods that are whole, real foods, less processed foods, things that don't have a lot of salt added, don't have a lot of fat added. Fruits, vegetables, whole grains are really on the top of the list. And this is the bad and the ugly. We all know about the fat and the cholesterol. These are the sodium. These are all really things that can lead to high blood pressure, increase your risk of heart disease, and even increase your risk of some types of cancer. The total fat, the area, again, that's 12 grams on this label. This, just so that you know, includes both good, what we consider good and bad fat. So this is an area that we're hoping to see changed a little bit on the label as well, just because the total fat is not really a good indicator. We know now that there are some fats that are very healthy, things like avocado, things like olive oil, nuts. Polyunsaturated and monounsaturated fats are good for you. In the past, like 80s, 90s, the whole low-fat diet craze, we don't really want to encourage that anymore. So hopefully there will be some changes on the new label that will help people understand really what, the good fats are and how to focus more on the good fats and get away from some of the saturated fats and the trans fats that are bad for us. And then the sodium, this is, obviously something you want to limit if you have high blood pressure or if you have cardiac disease. And so definitely you want to limit that in your diet. And then the trans fat. Trans fat could be labeled as 0. This is one thing that a lot of times people don't realize. Even if it says 0 trans fat on a label, that can be very misleading. The FDA allows you to still have traces of the trans fat that can really add up throughout the day. So don't, rely on the numbers next to the trans fat. You really want to just stay away from the ingredients that we know have, high levels of trans fat, things that are labeled partially hydrogenated soybean oil, partially hydrogenated cottonseed oil, things that have vegetable shortenings. Those trans fats can be very harmful, especially with people that do have a higher risk of cardiac disease. And then the rest. These are things that will kind of break down these nutrients. Protein is first. Protein is really is a nutrient we really don't have to worry about increasing in our diet. Most Americans get about 3 times the protein that you really need, especially men. A lot of times we do have to, I do have to kind of remind my patients, you really don't need 6, large servings of protein a day. You really don't need, 100 grams of protein a day. There are exceptions. Some people do need more. Again, if you're an athlete or if you're healing from an injury, but for the most part, we get plenty of protein. So there's a list here of some things that would be better sources of protein, like lean meat and fish and eggs, low-fat dairy products, beans and nuts. But for the most part, the protein we don't have to worry about getting enough of that. The carbs, though, this is an area of confusion. Very frequently, people are confused by the total carbs and then the fiber and the sugars. Because the fibers, the sugars, the starches, they kind of blend together. People don't really know which are healthy and which that they need to stay away from. Just a good rule of thumb, just to make sure that you are getting enough fiber, just to make sure that you are getting the nutrients that you need to try to make at least half of your grains whole grains. So here you can see things like whole wheat, brown rice, whole wheat pasta, couscous, quinoa, barley. These are all whole grains. Be careful when you do look at a food label, just because it says wheat flour, like unbleached wheat flour or semolina flour. These are not whole grains. These have been refined. So even if they do still have a little bit of a brown tint to them, it doesn't mean that they're whole grain. So be really careful when you're looking, making sure that you're getting a whole grain. And then sugars. This is always probably the biggest concern. Obviously for those that are diabetic, but then those that are trying to decrease their calories, decrease your sugar consumption. As far as sugars go, there's really not much there other than calories. So things like naturally occurring sugars and then refined sugars like table sugar, corn syrup, they're basically what we consider empty calories. They're giving you calories, but they're void of nutritional value. So be really careful. A lot of times some sugars can claim to be healthy. One common area of confusion, I have people that think, brown sugar is healthier or sugar in the raw is healthier. It may not have some of the additives, it may not have been bleached, but it still is the same calories. A lot of times, a tablespoon of sugar in the raw is the same amount of calories, the same amount of sugar, same amount of carbs as you would have in, the brown sugar. So be very careful if there's claiming to be a healthy sugar. It still has a lot of calories, still would contribute to weight gain. And this again is a proposed area of change, breaking the sugars down a little bit better. Really the most important part, I know the whole label, this label itself, there are very few areas on here that I focus on when I'm looking at foods, comparing foods in the grocery store. There are areas, obviously the serving size, you want to look at that, focusing on the calories. But probably the most important thing on the whole label, on the whole panel, is this ingredient list. Because this is going to tell you if what you're eating is a whole real food or is it something that's been processed and been refined. Foods that have, foods that have the least amount of ingredients really are the best for you. Kind of a general rule of thumb is 5 ingredients or less would be considered more a whole food. A lot of times when you get into panels that have an ingredient list and it has 25, 30 things on it, we know that that's been processed. It has preservatives. It has, colorings or dyes. So really the smallest food ingredient list that you can have, really the best. And also it's important to know, a lot of people don't realize that the ingredient list is organized by weight. So whatever comes first on your ingredient list has the most. So if sugar is one you always want to look for. If you're in the cereal aisle and you're comparing two cereals, if sugar is one of the first 3, 4, 5 ingredients even, that's pretty high. You're getting, sometimes, the sugar can come before the corn or can come before the grain. So make sure that you have the healthy ingredients first, and then if you do have sugar, it's one of the last ingredients on your list. Look for whole grains. That can be confusing. So you really, if you're doing bread or if you're doing a cereal, you want it to be like whole wheat or whole grain or whole oat to be the first ingredient on the list, not the third or the fifth. One thing that's always is kind of comical to me, even as a dietitian, it's still confusing looking in the grocery store. I have 2 young children, and we were in the grocery store in the cereal aisle, and my daughter points out that the Rice Krispies, or that not the Rice Krispies, the Lucky Charms are whole grain. She points out and says, "Oh, those are whole grain." And I kind of did a double take, and I'm like, "What?" And she said, "It says there are 8 grams of whole grain. Can we get those? Those are whole grain." And I mean, there is whole wheat there. There's a whole grain there. But sugar comes before that whole grain. So, the marshmallows come before that whole grain. So it's very deceiving. People know what they're doing. The whole marketing, the companies know what they're doing. They put that whole grain in giant letters so that you grab that thinking that's a better choice. So be really careful. Do look at that ingredient list. Flip the box over. And don't rely on the front of the box, because they're going to tell you whole grain, whole wheat. There may be some whole wheat in there, but it may be after sugar and butter and shortening. It could be one of the very a trace amount, and they can still put it on the front. And this is just a comparison. A lot of times people don't realize, you think you're doing a good thing like yogurt, think you're doing a good thing by maybe doing the fruited one. It's a good snack. But if you don't look at the ingredient list, you don't realize it has high fructose corn syrup. It may have additives that really aren't necessary. A lot of times doing just a vanilla yogurt or doing a plain yogurt and then flavoring it yourself, or just making sure that you compare them and make sure that there aren't these hidden sugars, there aren't these hidden fats in your products. And then this is just a comparison just to show you, even though you may not think there's a big difference between, say, a 2% milk and a skim milk, if you're one that really does need to be watching the fat or has heart problems and needs to be getting that saturated fat out of your diet, it makes a big difference. You can go from, say, 15% of your daily value to 0%. So do compare those labels and make sure you're getting exactly what you think you're getting. And last off, the portion distortion. This is one thing that, we all know, what a hamburger looked like in 1980 and what it looks like in, today. Sometimes they're 2-3 times the size. Same thing with drinks, same thing with fries, same things with store-bought products. So really just make sure that, you are looking at those labels and you're realizing just how much you're taking in. A lot of these food labels were constructed, they were developed in the 60s and the 70s. When those labels were made, our plates were about 8 inches in diameter. If you've bought china or if you've bought plates anytime lately, the plates, it says here that the average is about 12 inches. I know we bought bowls not long ago, and they really, I see why you would eat 2 or 3 cups of ice cream. You have to fill that bowl up. So just be careful with the sizes. And always note the servings again on the side, on the back, even of snack size packages. This is something that's always kind of a surprise to my patients. You know, if you buy like a grab bag of chips, I know nobody buys chips, but if you did, get in a pinch and you bought some chips, a lot of times those grab bags are like 2-3 servings for a bag. You know, you buy that, you think you're having a snack and it's, you know, one serving. A lot of people don't think to look. You know, those Doritos, they could be intended to be 3 servings. Same thing with a soda. You know, a 20-ounce soda, a lot of times the manufacturers are getting better. They're getting better at, you know, making it more realistic. But if you buy a Coke product, a lot of times they're taking into account that that's 3 servings. 20 ounces is really supposed to be 3 servings. Who here splits up their soda and drinks it, you know, 3 times? I know you drink a little bit, put it back in the fridge, but so really just make sure that you are drinking or you're eating what you think you are. And then these are just some estimates, just so you kind of have a visual. A cup of pasta is about the size of a baseball. Half a cup of fruit is like a light bulb. A tablespoon, like if somebody tells you, you know, eat a tablespoon of peanut butter is a serving, or a tablespoon of hummus is a serving. That's like a ping pong ball, golf ball, not the baseball. So, you know, be careful with the servings. An ounce, like if you're doing cheese, that would be like 4 dice, or a string cheese is an ounce. And then meat, a serving of meat is 3 ounces. So that's like the size and the thickness of a deck of cards. A lot of people eat more than 3 ounces. Yep. Yep. I know. Yeah, so if you have your 10-ounce T-bone, yeah, that's your servings. Yeah, that's 3 of your servings. It's not to say that you can't eat more of that. You know, it's not to say you can't have that, you know, 6-ounce steak or that 6-ounce, you know, lamb chop, but, you know, that's really considered 2 servings. You just really need to take into account that that's, you know, probably going to give you a little bit more fat, probably going to give you a little bit more calories than you need. And back to the sizes of the plates, downsizing, you know, a lot of times it's really helpful. In our house, we started using, well, most of us use the salad plate instead of the large dinner plate, because it really helps you to feel, especially if you're one that's really trying to watch the calories, if you're really trying to watch the portion size, you know, switch, you know, go from that big, large dinner plate and use a smaller salad plate. A lot of times they're probably closer to that 8 inches or, you know, 6 inches that they were a few years ago. It makes you feel like you still have a full, you know, you still have a full plate. You don't feel deprived, but you probably have an appropriate serving. Same thing with like cereal and oatmeal and ice cream. You know, use those smaller, you know, like condiment bowls or smaller, older bowls. We have some that are more like Corningware, you know, they're used, you know, more for condiments or used for cooking, and we'll use those just so, because if you have a cup of ice cream and it fills that bowl up, you feel like you're eating, you know, you're not depriving yourself. Same thing with glasses, especially if you're drinking something like sweet tea or drinking soda or juice, something that has a good bit of calories. Use a taller, thinner glass so you feel like you're drinking more, but you're not really taking in so much. Another thing is dish it out before you eat it. You know, you don't want to sit in front of the TV with a bag. You don't want to sit in front of the TV with a box, or a thing of cookies, or the bowl of ice cream. So dish it out so that you know you're getting the serving that you're supposed to. And slow it down. You know, I find we all eat way too fast. You know, it takes your stomach about 20 minutes. It really takes you about 20 minutes to realize you're full. So, you know, slow it down, try to stretch it out over those 20 minutes so that you don't overeat and so you don't take in a lot more calories and fat than you need. And this is just some humor. You know, it's kind of far stretched, but, you know, I've seen things that are pretty much, you know, almost as ridiculous. So if you're eating, and you have a label in front of you, look at it, make sure you're eating exactly what you think you are, and adjust accordingly. All right. Does anybody have any questions? Yes, ma'am.
How about artificial sweeteners?
Artificial sweeteners. That's one thing that we're hoping that they're going to label when they do the new label. The label, and I didn't mention that, it'll probably not really go completely in effect until 2016. Over the next couple of years, we'll see things slowly changing and then getting some feedback as far as the labels go. Artificial sweeteners are not labeled right now. So unless you know the name of the sweetener itself, look in your ingredient list, the list of the names, it's very hard to tell. So, I mean, obviously the artificial sweeteners, they're obvious, you have the research that discourages people from doing them. I'm really one that thinks that we're going to find out in a few years that those artificial sweeteners are just as damaging, as the sugar itself. So I would say, try to stay away from the sweeteners, or do one that is more natural, like stevia, or like an agave nectar, or a little bit of honey. Something that's more natural and not chemically made, and I think we'll be better off. Yes?
Why are liquid sugars like a Coca-Cola a little more dangerous?
The liquid sugars, a lot of times, do you mean like the liquid, like the corn syrup, like the high fructose corn syrup?
Like a Coca-Cola.
As far as dangerous, a lot of times it's because they're processed. Just the way that they're processed, you absorb them easier, absorb them faster. There are also sugar alcohols in some things as well. So a lot of times that is more dangerous just because of the GI problems, just because of the gastric upset. But the liquid sugars, a lot of times it's just the way they're processed. You absorb them differently and faster. So a lot of times you see the spikes, the spikes immediately after you drink something that's in liquid form, and then you crash.
Question.
Yes.
My wife has stopped the kids from drinking sodas, and she's giving them a lot of juice. Is there a lot of sugar in that juice?
Yeah, it's natural. It is a natural sugar, but it's still sugar. So we recommend, limiting juice to about once a day, or we'll water it down. Maybe just put a little bit of juice in their water so they think they're drinking juice. Well, you can't fool him then. Yeah, I would say, it's better to do the water, limit the juice, because it is really still a high source of calories and sugar.
So when I hear smoking and drinking are still okay?
Yes. No. Yeah, I'm ready.
That'll be the last question. We'll end it with Jeff's comment. And he did pass me that note in the middle of it, and I got another public service announcement for Roscoe. He took out all the calories and all the fat out of that meal you just had. So I think you're all right for today. But what genius by Wellstar bringing a nutritionist. Everybody run to your doctor. I mean, my goodness. But actually, it was John leaned over and said to me, he said, this is actually useful information, because I don't think any of us really look at the labels when we go to the thing. I see something that looks good, I buy it. So I'll get it back on script now. Thank you, Rachel, for taking time out of your schedule. And just a couple of quick closing comments. The Chamber's Business and Community Expo is May 3rd at Arbor Place Mall. Great opportunity for your business to get in front of thousands of people. We're taking exhibitor registrations, so sign up now with Kimberly to get the best locations. Kimberly does have that. Thanks again to One Community Church for the use of their facility, to Sam and Roscoe's for the great food and for taking out all the calories, and Wellstar for sponsoring today's luncheon, and Greystone Power for their naming sponsorship. Thanks for all of you for attending, and we look forward to seeing you on Thursday, March 27th at Starla Womack State Farm for our Comcast Business After Hours. Y'all have a great rest of the day.